Hydroxychloroquine, an anti-malarial drug, is being used by several countries as a preventive measure for COVID-19, even though its efficacy against the disease has not been proven yet. India partially lifted the ban on the exports of hydroxychloroquine after President Donald Trump sought supplies for the United States. India would now continue to export the drug to those countries which are largely impacted by coronavirus. But concerns have been raised on whether India has enough supplies for its own use. India manufactures 70% of the world's supply of hydroxychloroquine and is the world's largest exporter of the drug. Ipca Labs, Zydus Cadila and Wallace Pharma are top pharma companies manufacturing hydroxychloroquine in India. Now recently, the government had placed an order for around 10 crore tablets of HCQ with Ipca Laboratories and Zydus Cadila. As per the official reports, the current production capacity of India is sufficient to meet the current demand, and if the need arises, the companies are committed to ramping up the production as well. But there is also a growing concern among activists that the export might result in shortages for patients already on this drug for other diseases like malaria and arthritis. Experts also see another big red flag fast approaching. What happens if the pandemic surges in India and perhaps reach African nations too? Well, India has already got requests from 30 countries ranging from the US to Latin America to Europe for hydroxychloroquine. Ipca Labs in media reports has highlighted that the people across India began hoarding the drug post-India lifted the export ban, and that has caused a shortage and not the supply reduction. Another thing to note here is that India gets the active pharmaceutical ingredient that is used to manufacture hydroxychloroquine from China. Now, the good part is that supplies from there have also become quite steady, so the companies have the raw material to produce now. Each COVID-19 patient reportedly needs 14-tablet course, and so the 10 crore pills ordered by the government can potentially treat over 70 lakh people. As per Indian Drug Manufacturers Association, while the current requirement for the drug is 24 million tablets per year for other diseases, around 40 metric tons of APIs for hydroxychloroquine, India can make around 200 million tablets of 200 milligrams each, thus indicating that India has enough spare capacity. So concerns on that front have largely abated, and we just need to see how much would the country really need for both the prevention and treatment of COVID-19 now.